Daniel, hi, and thank you so much for joining me here on Faces of Digital Health to discuss your view on healthcare innovation. You're known as someone who basically has the best overview of healthcare innovation, like the craziest new things and ideas that are out there. But actually, since before we started recording, you mentioned that you didn't have a lot of sleep, and I'm quite tired since we've got the time difference and it's 9 p.m. on my side. What are your favorite innovations in the sleep space? What do you use to stay optimal?
Well, according to my Aura ring with my sleep score of 55 today, because I had a late flight from New York back to San Francisco, it's not often jet lag. It doesn't help. But my favorite low-tech innovation is just a good sleep mask. You know, there's all these simple things you can do, a cooler room, a sleep mask, putting your smartphone away from your bed. These are not high tech. They're just things that we often know but can be reminded to do. And then, of course, I've got my Aura ring, my Ultra Human ring, my Apple Watch, and my Whoop, and they all give me slightly different sleep scores. So I picked the one that gives me the most REM sleep. But it's a reminder that, you know, it's one of the most, you don't need fancy things in health to do the right thing, whether it's to work out, to eat right, to exercise, to have good social connection. Sometimes the digital tools that we can talk about can help you nudge in those directions or give you virtual elements of those. But nothing quite replaces sleep. But we are seeing some digital health tools and technologies trying to hack your sleep. There's a couple now wearables that try and play you music when you sleep. There's a few ones that are putting in not just sound waves, but maybe some forms of neurostimulation or electricity as medicine. So I'm hoping to get my, 6 hours being worth 8 or 10 in the future.
Oh, that would be lovely. I would love to have that to just, be able to do more. But I do agree with you that, sleep is like the number one thing we need to be mindful of because it has implications in cancer, in various diseases. And I love the fact that you basically emphasize that many times it's important to just stick to the basics, sleep, eat pretty diverse food, exercise. And one of the things that kind of fascinated me lately is I kind of am coming across a lot of articles and books that basically emphasize the importance of exercise as one of the key things for longevity. So what else do you see in the longevity space and this balance between being high-tech and being just a worried well and actually doing some things that are more simple and less expensive to achieve similar results?
I mean, we are in this exponential, high-tech, digital, super connected age. Sometimes that can be, bad for health. We know, I've got young kids that your mobile devices and social media for kids or adults can be bad for your brain and your sleep. And I think there's a new emphasis. I think I was always pushing against the term, longevity. I'm here in Silicon Valley. A lot of people want to live forever. That's a long time. But I think more people want to live to 120 and feel 50, 60. It's this idea of Healthspan and optimizing that. And this idea now that's in the zeitgeist of being proactive, moving, and when you're younger and healthier, doing the things that are going to maintain your muscle mass, your bone, your brain, your immune system, so that you can have that Healthspan piece and not wait for the sick care model that we're so used to, which pays for disease management once it's occurred. So back to the simple stuff, sleep, exercise, mindfulness, social connection, diet. The challenge is we often know what we're supposed to do. There's lots of studies. We can get presented with all the charts, but it's really hard. The hardest technology is often behavior change. And I think what's emerging in this new field of digital health, it's AI enabled, et cetera, is I like to call it not AI or generative AI, but generative health. This idea that, if you're in Europe or California, if you're 16 or 67, if you like the color blue and you have a personality type that's an extrovert or introvert, your health coach will know that. It will know your genome from when you've been sequenced. It will know your sociome, where you've been. It'll know that I'm jet lagged from last night. My Apple Watch won't tell me when I'm sitting on a plane in the aisle window seat that it's time to take a walk. It'll have context, and it'll be almost this idea of your personal avatar. It might show up with the right music, the right nudges, the gamification that works for you to help you do those basic things. And small changes, a little more exercise, a little more steps, a little better diet, reminding you in the right way without nagging you, aligning you. You like points, I like badges, someone else wants social cred. I think that's going to be an exciting part of this new age. And we're seeing, I think, OpenAI with Thrive announce some new platform that's going to be, I think, that next generation human coach meets digital health meets doing the basics. And that's staying away from the metformins and the drugs and the gene therapy and those things that are sometimes still early, sometimes snake oily in the mix that will, if you stay healthy for the next 10, 20 years, I think some really amazing things will be there that will help stop and even reverse aging.
Speaking of AI, we are kind of moving away from the hype that was caused with open AI. So what's your currently favorite thing in AI applications? What do you think is not going to turn into reality anytime soon? You're also a physician, so even from that perspective, where do you see the most potential? And also, even with AI, at the moment, we focus on generative AI. And in the past, we had this challenge of companies calling every algorithm AI or any computation AI. So where do you see the clarity in the space around AI in healthcare at the moment?
Well, as you mentioned, there's often a lot of hype, right? And we all know Moore's law, the power of exponentials, our supercomputers getting faster, cheaper, fitting into our rings and wearables and inside-ables. But there's my other favorite law is called Amara's law, which in a nutshell is that we tend to overestimate what will happen in a couple of years. We overhype where AI is going to be in 2 years or another technology, but we underestimate where it will be in a decade. And if we look back a decade earlier, 2011 or so, we had IBM Watson, and we thought we'd have Dr. Watson in 2 years, and it would be our AI agent for medicine. So that was overhyped, a little overmarketed. But now, a decade later, we now have multiple FDA cleared products for radiology, for example, seeing all the evolutions of AI and drug discovery that are getting super exciting. So I think what's most relevant now, it's still early days. There's the low-hanging fruit of helping the doctor and nurse and clinician avoid burnout with taking our conversations and making them easier to process. We're doing all the grunt work. But the biggest gaps are where we can close the gap. I just invested in a company called Jivi Health out of India, along with Andrew Ng and his AI fund, where they're building really the ultimate AI doctor for the poorest in India. Everyone in India has a smartphone, even the ones who live in slums or in rural villages. And now they have no access to primary care. They can do smart triage. They can speak in Hindi. They can upload their labs or x-rays. They can triage them to telehealth or a real clinician when they need it. So there's big gaps in places outside of the US or the Europe realm where these things can happen. There's no lobbies. The doctor lobbies aren't strong. There's no underlying care in many cases. So that's where I think it's exciting as well. We can learn from those, come as leapfrog the West. We'll learn and those will come back and enable us to have really powerful personal clinicians and health coaches in our pockets. So those are a couple areas I think of convergence. Just remember that we get excited about the 1 or 2 year view. We're only at ChatGPT 4.0. It'll be, 6.0 will make 4.0 look slow. What might we see in a decade? How do you design your startup, your platform, your hospital system, your clinic to be a little future-proofed, to remember the exponential and Amara's law, not just Moore's law, so that you're sort of designing a little bit ahead of where the puck is today?
Which piece of technology is currently the most interesting to you? And I mentioned that, when you have presentations, you usually present a very broad and detailed overview of all the fancy, interesting, and unusual tech even. So how do you do that? How do you find and keep track of all these crazy things?
Well, 10, 12 years ago, I gave my second TED Talk. It was called The Future of Medicine. There's an app for that. And back in 2011, there was maybe 10,000 or less health-related apps. Now there's several 100,000. Back in 2011, there were a couple wearables. The Fitbit had only come out in 2009. Now we have hundreds, if not thousands. So I built a platform to help me keep track and others called Digital.Health. If you go to Digital.Health, that's the website. We have over 3,500 companies and solutions. So if you put it in depression, diabetes, AFib, practice management, robotics, you'll find solutions out there that you might want to use as a patient, as a clinician. So I use that as a bit of if I see something new, I'll put it in the database. And other folks are adding their solutions as well. So that's one way I keep up. I still, like you, use social media, Twitter, read Nature, New England Journal. I'm here at the Stanford campus today. I just met 15 companies, digital health companies from Canada who are visiting. So it's hard to have any one path. I think, in medicine now, as clinicians and as innovators, you can't stay in one little silo. And as you know, I share this conference called NextMed Health, it used to be called Exponential Medicine. The magic has always been bringing people together and ideas from different fields, from AI and wearables and robotics to synbio to psychedelics to chatbots to drones to nanotech and sparking the cross convergence. So I never have one favorite technology. It's often where you blend them together. And I can talk about some favorites that are blending them together as well.
Yeah, talk about your favorites.
Well, I mean, I was always, I've been an early adopter of augmented and virtual reality. I've had all the Oculuses and I still have my Google Glass in my backpack. It's broken. But now it's getting kind of magical. I mean, Apple Vision Pro, still a little heavy. But when I put on Apple Vision Pro and I was sent from my friends at Cedars-Sinai, there's a platform called Zaya. It's a mental health platform. And my wife's actually getting a master's in psychology right now. And she tried it as well. So you go into the headset. It's like you're in your living room or house. And then this smart robot pops up and it speaks to you. It remembers your name, remembers your medical issues, if you have a stress, anxiety, or clinical anything, it'll talk to you. It'll give you recommendations. When you come back 2 days later, it'll remember. It'll give you homework. It can put you into a meditative environment. So it's the first time I've had that experience of being in a very high resolution, having another being, in this case, an AI-enabled virtual robot that I had a clinical interaction with that felt very smart. It felt intuitive. It put a beautiful environment. You talked about sleep or flowers, and you'd be in a meditative room. And these will be tools not to replace your psychologist, but to maybe be the homework. They can help monitor you. If you have a patient with, God forbid, suicidal ideation, it might help report that to the clinical team. And that's not just going to be for mental health. I like to talk about not the metaverse, but the mediverse, where our clinical interactions will be well beyond the Zoom screen, and we'll start to blend modalities and be more multimodal. So that's one example where things are coming together. It's an example of AI, virtual reality, smart systems, smart design thinking, and a platform built on real clinical evidence.
What we saw after the pandemic wasn't that everything suddenly was managed through telemedicine. That was a little bit of a disappointment because it was expected that this is going to be the new reality. But what did shift is the increased interest into how we can provide more care at home and improve the experience through that end. Last year at NextMed, Rasu Shrestha basically talked a lot about the partnership between Atrium Health and Best Buy, which was really, really interesting. And I remember him, I think, or somebody else explaining to me that when, because of COVID and burnout and everything, a lot of nurses went into stores because the jobs there are so much more or so much less psychologically exhaustive. Best Buy realized that actually they have a lot of medical force that can already learn or share a lot of their existing knowledge to expand this healthcare area. So I actually wonder, which parts of healthcare do you think are still going to stay in strict brick and mortar in all the hospitals and facilities? I mean, you can break down silos, you can introduce technology, but you're not just gonna abandon the buildings that are already there. You just don't demolish those. So how do you see this change to the home at the one hand, and basically the existing infrastructure that's not going to go away anytime soon?
Yeah, great question. We are moving a bit from hospital to home, hospital to hospital, I call it. And a lot of the dots are here. Now the trick is putting the systems and the incentives and the workflows together. At NextMed Health this December, we'll have Jared Connolly, who helps chair the hospital to home platform at Mass General Hospital. So where I train at Mass General now has a hospital home program. They also have an emergency room at home program. How many emergency and urgent care visits could be managed with smart telehealth and the right diagnostic and the right home triage kit, for example. And of course, healthcare is a continuum. When I trained at Mass General, I don't know how many times we'd wait one extra day for that patient to get one more lab or wait one more temperature. And of course, hospital care is super expensive, and it's also not the best place to get well. In some cases, it's loud, etc. So can you discharge the patient a day earlier? That's an early model, right? Now with patches from Vital Connect to biointelligence, in some cases you never need to admit the patient in the first place. As many of the reasons we admit someone is to watch their vital signs. And the trick, though, is to get the clinician, the nurse, the order flows, the data to flow in a way that isn't overly taxing, right? No one wants to look at all the patient's data. It needs to be filtered, and the AI needs to be trusted for the right levels of alerts. there's lots of things involved. A lot of it is more culture, payment models, regulatory, and getting the clinician culture moving into this. Of course, we'll still need hospital centers, triage. I'm right down the street from Stanford tertiary care, but there'll be sicker and sicker patients there, and the ability to manage a simple pneumonia. We're already discharging folks from home from their orthopedic procedures, which used to stay there for a week. And as the money goes and the incentives flow and we get better outcomes at home without infections and demonstrate the ability for your smartphone camera to look at that wound and track the care. You don't need to drive in and have your, appendectomy scar looked at. Those will all show value and benefit. But it also means we need to train our clinicians differently. Who's going to go to medical school? How do we train them in virtual versus physical care? I got digital care. You need not just good bedside manner. You need good webside manner. We might need a whole new generation of workforce to smartly use these tools. And often there's a lot of folks who are stuck in the old models that don't want to change because the dollars come to heads in beds. So we need to change. So it will happen in some places, NHS, Kaiser, Geisinger, where it's a payvider rather than the ones that get paid for more hospital admissions.
One of the speakers in the recent episodes from Canada said a very interesting thing. We were talking about business continuity and how when we talk about digitalization, we all always focus on digital data gathering, but many people are really not aware that systems go down in hospitals, and for the business continuity's sake, for that hour, half an hour, in some cases, if there's a cyber attack, that's even more days, the processes go back on paper. And what she mentioned is that she said, now we have junior doctors that are trained with digital systems and they don't know how to chart on paper. So I think we're kind of, we have a very interesting mix of challenges when it comes to healthcare, but definitely the increased need for digital literacy is the number one, I think, priority in speeding up the adoption and affinity to using tech.
Yeah, but I want to raise the point that there can be a downside to digitization and AI enhancement. So when I was a medical student and resident, we used to handwrite our notes. Well, you had to think. You had pen and brain to pencil. You cognify the notes. Now in the EMRs, it's cut and paste or quick dictation or voice to AI to writing it. Do you still have the time to use their cognitive brain to think, to do a differential diagnosis? Now we're of course in the era of ChatGPT, which is wonderful. And there's this quote from Sam Altman, the founder of OpenAI. He said, GPT is like an e-bike for the brain, And now you see all these kids in my neighborhood riding e-bikes up the hill. They're not biking and getting their muscles up. So I say, okay, GPT is great. It's an e-bike for your brain. But what if your kids never learn how to ride a regular bike or never learn how to develop their biking muscles? Or you probably grew up on GPS maps. I grew up with paper maps and then I had GPS maps. But kids today, they don't have three-dimensional sense. They don't know their way around without relying on GPS. Or the doctor who trains with ChatGPT never gets to develop a differential diagnosis by themselves and use their brain muscle. So where is the convergence of where technology and our human abilities merge, and how do we maintain our human abilities, knowledge sets, and blend those? Because, usually AI with the clinician is better than one by themselves. So I think that's an open question. And also, how are we going to train nurses, doctors, medical students of the future to integrate these tools when we don't need to memorize things like we used to? It might free up our brains for not just IQ, but EQ, better patient-doctor relationship, more even digital empathy, whether we're talking virtually or in person. It'll hopefully open up the ability for clinicians of all types to be more with their patients. But there are some downsides to technology as well.
Definitely. And I think I didn't mention before, but it's important to emphasize that when we are moving to at-home care, a lot of that is happening because we are going into a bigger shortage of clinicians and the system being overburdened. So it's not that home care is ever going, not ever, but it's not going to soon replace hospital care, but it is helping alleviate the pressure on healthcare systems and enabling that people who need care can receive it.
Well, I'll make a point just that if we look to the future of home care, I mean, people want to age in place. They don't want to go to the nursing home or the hospital. If you can imagine the art of the possible, I mean, all of these things are already somewhat here today. The Tyto cares of the world, now the home COVID tests are becoming home, diabetes tests are becoming home, cancer tests. 10 years from now, where could we be? Well, We should all have, some Bluetooth component from our smartphone. They had to have a medical tricorder. I actually helped to develop an XPRIZE around that. We could all have a pretty low cost diagnostic device that does all our vitals, tracks them over continuity of time, including those from your wearable devices and their cameras and our environments to track them. We can have a smart dispensary, right? I have a little technology. You can watch my TED Talk in telemedicine, 3D printing your pills at home. So dispensing medications can be done with either the actual pill or maybe blending the medications you need. The voice as an interface, you could be 99 or 9 and still talk to the AI health agent that could help you through things. And then care still needs humans. We're not going to replace with robots quite yet. The humanoid robots are getting there. How do we upskill the mother, the grandmother, the home health aide that's not a nurse to use the AI to help make the early diagnosis or help triage or manage the therapy? So it's this interesting blend. And I think those of us innovating in digital health and beyond need to be thinking about how do you connect those dots and maybe creating some of those visions of the not so distant future to help the technologies merge.
Mm-hmm. Here's a maybe tricky or specific question for you, because you like to focus on the positives and like the positive aspect and vision of what healthcare could be and how technology could improve the situation. What are you most skeptical about?
I mean, you could still be, every startup I see is an AI startup, so you can still be a little skeptical about, where are the insights coming from? Of course, bad data in, bad insights out. There's still a need to diversify our insights, whether it's the genome or the metabolome or the digitome. So sometimes the claims are still a little bit ahead of the skis. I'm still skeptical about, or sometimes it's disappointing to see some amazing digital health companies, for example, in digital therapeutics, have challenges, even whether it's Indiga or companies that never got adopted properly in the United States because no one knows how to prescribe them or smartly pay for them. So it's often the business models are the challenge. And here, especially in the United States, we have so many misaligned incentives, so many different scattered health systems. The harder part is getting your amazing technology innovation into the right hands and utilized to create the value. So sometimes it's easy to get excited about the new tool, technology, idea, startup, but how do you really plug it in and integrate it is often something not to be skeptical of, but to be mindful of. I'm a stem cell biologist, bone marrow transplant clinician. I think there's still a lot of hype around stem cell therapy and people going to Caribbean countries to get stem cell therapy of all sorts for things that aren't well proven. So while a lot of folks are trying this longevity approach, I think we need to be open-minded and allow people to crowdsource trials. If you're going to try something new on the edge, maybe that data could be collected in a virtual way, and we can measure the impact and we can all learn. With XPRIZE, we just recently launched a $101 million Healthspan XPRIZE to see about stopping and helping reverse aging and measuring that in the metabolic, the muscle, immune system, and brain. Those are all challenging to measure. How do you measure aging? So those are a couple of things off the top of my head that are still always challenging. How do you integrate into actual solutions, given the diversity of platforms? How do you prove that things work, have the right data and insights, especially in AI? And then how do you not have too much snake oil in there that can sometimes be harmful, and at the same time bring now everyone to be a data donor so that we can build these virtual smarter learning engines and not waiting 17 years from something being published in New England Journal to being something that you and I can use or we can start to prescribe and bring to the impact at the bedside or the website.
You just got me thinking how with various things that we discussed, how convenience is such a top priority and important part of new technologies and delivering care, but at the same time it's exactly what's also, I don't want to say making us more sick, but it's definitely making staying healthy more difficult. And I'm talking about processed foods, so you don't have to eat. I'm talking about electric bikes that you mentioned. Instead of biking to work, if you are in a place such as, in European cities, in a lot of places you can actually do that. In the US, like when the distances are much larger, it's not that practical to do that, because then you would need, I don't know, too much time spent on the road, or using stairs instead of elevators. So there's so many things that you can seamlessly embed in your life instead of sitting all day and then going for a half an hour run. And food as medicine was also one of the topics at NextMed last year. So how do you see that? You know, the kind of relationship between how we design our policies, how we shape our society, taxes on sugary drinks and things like that, to actually prevent us from needing patch solutions for the problems that we created for ourselves.
Yeah, great question. I think there's a statistic that about 80% of our chronic disease and our costs and our morbidity and our mortality is driven not by our genetics, but by our bad behaviors. Not enough sleep, too much stress, bad eating, too much alcohol, not enough social connection. And now we can, of course, start to measure these things with the digital tools, but the behavior change part is hard. And you mentioned the word, how do we, it's a lot about design, right? Food is medicine. It doesn't need to be medicine. No one wants to take their medicine, but I think there's been these studies where, I think they did this at Google. You know, a lot of folks would gain weight because they would go to the snack bar when it's free food at Google, and they started to put the sugary stuff, behind, not hidden, but, not out in the open. They were still there. And that reduced calorie intake by several hundred calories a day. Or in the cafeteria, if you put your salads up front in the beginning of the line, it changes your salad intake versus at the end when your plate is already full. So some smart design. Designing cities, designing schools. Do you have to walk? Is there a way to walk across the park? Thomas Getz spoke at NextMed last year about his Building H project, which is also around designing your healthy communities, whether it's your home, your place of worship, the parks. So you make the smart decision. You don't have to take the bus because there's an easy walking path. So some of it is sort of making it easier to design and integrate those healthy behaviors into our daily practice. The blue zones, they're often in villages where they walk every day until they're 90 plus. And so if you design social connection, you design your cafeteria at work to make sure people mix and mingle, not sit neat in a cubicle. All those can be really impactful. How do you provide meditation spaces? All those things are design elements. And even how you design the clinic and the hospital in the future, they're often loud and noisy, and you can make them with windows and quieter elements and ways to let people heal and visit, that all end up, I think, impacting health in subtle ways over the long periods of time. So that's part of it.
Yeah, I think one of the interesting areas that still needs a bit more exploration is the whole impact of the hospital experience on patient outcomes, because we know that hospitals are scary and that creates stress, and there's a lot of research done mostly on the challenges in ICUs because of all the beeping and noises, and some innovators have already tried to mitigate that with giving patients music so they can avoid all those sounds. But yeah, that's definitely still a lot of things to do research on when it comes to behavioral and kind of environmental changes. We are close to wrapping up, but I do want to kind of peek into the program of what NextMed is going to bring to the audience this year in December. So if I just mention a few things that were presented last year, there was a presentation on non-invasive deep brain stimulation based on sound waves. It was mentioned that one of the wearables is developing a new digital sleeping pill meditation program specifically designed for cancer, menopause, or cardiovascular disease. Mary Lou Jepson, the CEO and founder of Open Water, shared findings on the use of phase of waves via interference to basically impact glioblastoma cells without damaging the healthy tissue, and much, much, much more. So can you be specific in sharing some of the things that many will probably hear about for the first time and will be able to learn more about in December in San Diego?
Sure. For those of you who don't know, I've been running since 2011 a program now called NextMed Health, where the theme is to bring people from all these different fields together to look at where things are going. It was called Exponential Medicine until 2019, and for every year we bring about 600 people from 30 countries together to see the art of the possible, what's now near next and what's needed. So this year, some amazing faculty coming that have never been. We're going to have Larry Brilliant, who's a famous epidemiologist, helped cure smallpox. He's now working on a precision Healthspan engine called Evity, and sort of the epidemiology of aging and longevity. He's an amazing spirit and soul. Dean Kamen is coming, one of my heroes. He's known for inventing the Segway, but he really started and is a medical device engineer extraordinaire. And he's going to share some of the work they're doing in patches and medical devices, but also his work on regenerative medicine. He chairs the Advanced Regenerative Medicine Institute. So that's exciting. Ed Boyden will be there, who's leading neurobiological engineering at MIT, one of the co-inventors of optogenetics. And he's doing work across amazing neurotech, including a wearable device that helps sleep, Elamine, that we'll hear about, as well as many other really almost science fiction elements in the brain. Public health and global health we'll look at. Michelle Williams, the recent dean of Harvard School of Public Health, will be there. We're going to look at how do you democratize healthcare and improve and reimagine public health with technology. On the mental health side, we'll have Rick Doblin, who's very well known for starting MAPS and almost got through the FDA, not quite yet, psychedelics for treating PTSD and his journey. We'll have Amir Dan Rubin, who was going to talk about what it's like to run a hospital system like Stanford, where he's CEO, and then also build One Medical, which recently bought by Amazon. Hugh Herr will look at the future of bionics and human-machine convergence. He's building some new wearable exoskeletons, whether you're missing a limb or you don't. I could go on and on. We'll have folks from ARPA-H funding the next generation of moonshots. Chris Mason from Cornell Weill, Ami Bhatt, the head of ACC Innovation for Cardiology, Foodist Medicine, William Lee will be there. Our friend Lucien Engelin from Europe. We always bring amazing groups from the Netherlands and Europe. So I won't run through the entire set of faculty, but we integrate art and music. We'll have Stephen Kotler, one of the leaders in flow state, on peak performance. Ken Dykewald again on aging. Jared Connolly on hospital to home. Of course, our kind of core talks and updates on AI, VR, synthetic biology, genetic engineering, policy, law. So it's a great place, as you've seen, and you wonderfully summarized for it, to bring people together from other fields to spark the art of what's now, what's coming next, and how do we better bring the future together collaboratively. And so there's no one theme. It's not all AI. It's not all wearables. It's not digital. It's sort of how do we think of future biopharma in this new synthetic biology age. We have some other folks coming. Looks like Eric Topol is going to join us. I'm working on a few other surprises. We'll have our silent disco, our beach bonfires, some of those other magic elements. And if you go to NextMed.Health, you can apply to join us, and we'd love to see many of you there.
Awesome. So, Daniel, thank you for sharing a little bit of that sneak peek. I'm sure more is going to be shared on the LinkedIn page and LinkedIn or at the website about the program and the speakers and everything. But yeah, for today, thank you so much for sharing this and taking the time in a lovely, sunny place, unusual spot for doing a podcast. Usually I ask people to stay inside, but I think this is very fresh, just like NextMed. So thanks again for your time today.
Thank you. Cheers.